Je sais qu'il y a beaucoup de travail pour arriver à aujourd'hui. Toutes mes félicitations, Dr. Rosenberg, et à toute votre équipe. Mazel tov.
There you go. That is Quebec's Health Minister, Sonia Bélanger. Little mazel tov at the end, congratulating Dr. Lawrence Rosenberg, who is on the line with us right now. He's president and CEO of Sante, Quebec, West Central Montreal, and Social Services University Network, basically the Jewish General Hospital. Dr. Rosenberg, thank you for taking the time. Let me begin by asking you, with respect to being designated, right, officially as a university hospital, what specifically that means and what it changes, if anything.
Well, I think, first of all, good afternoon. And this is something we've actually been waiting for decades. And it really gives the Jewish General Hospital recognition for everything it's done and its accomplishments that it's achieved over many, many years. So, that in itself, I think, is important. It certainly engenders a certain amount of pride amongst the employees who work here, who've labored really for years, delivering results that have been extraordinary, both within Quebec and outside of Quebec. And it's really a first step for us to, re-energize ourselves with this new recognition and to try to strive to a next higher level of achievement.
If I understand correctly, there's no significant dollar attached to this. This is not the Quebec government investing money in the hospital of any kind. What does it offer you, though, with respect to being designated and recognized this way? Are you able to attract more grants? How does it work?
It's really a provincial designation. There really isn't any other similar kind of designation in Canada. So within Quebec, it does open up possibilities going forward for certain funding programs or grants that may have only been available to the previously designated university hospitals or institutes. In the minds of those looking for jobs going forward, might make us a more appealing place to want to work because of the designation. So I appreciate these are perhaps somewhat soft things that I'm referring to rather than hard cash.
Right.
But at the moment, this isn't about the money. It's about who we are, what we do, how we do what we do, and getting recognition for it.
I mean, the Jewish General has been around forever. It's interesting that this happens now. Was this something you had sought? How did this come to pass?
Well, it's interesting. It's a good question because the last time the government designated a university hospital, it was about 30 years ago. So this is the first designation really of the 21st century, which speaks to your question of why now. I mean, I think the Jewish General over the last 6-7 years has really excelled in achieving levels of clinical accomplishment and research accomplishment that are comparable to any top-notch academic health institution in the world. And particularly in areas of digital health over the last few years, virtual care, we really are leading the country in that regard. And I think part of this recognition now is a result of what we've achieved in the last several years.
Does it change anything with respect to the rest of the health network? I mean, do you have more contact? I'm assuming that contact was already there. You always share information. Does this change anything? Does it make it easier somehow?
Well, the contacts were always there. I think there's a requirement that we will be held to now to perhaps become better partners with some of the organizations in Quebec, perhaps spend more time investing in partnerships with Francophone institutions than we may have in the past. Mm-hmm. But this is all part of what we were attempting to do regardless.
I think it's fair to mention when I said the Jewish has been around, I think it's more than 90 years that the Jewish General has been around. And obviously it's created some incredible and done some incredible work, incredible research. We have a chance to speak every now and then to Dr. Gerald Battis at the Siegel Cancer Center. Funding has never really been an issue for the Jewish, right? It's been a remarkable achievement, actually, over the course of the years to see how much and how successful the fundraising has been. So, I mean, this is an extra accolade. I guess my only other question would be, Dr. Rosenberg, does this allow you, do you think, to recruit people perhaps who you would not have been able to recruit before? Does it make a difference perhaps to them to come to a facility that's been designated a university hospital?
Well, for some people, perhaps. Like I said, this is really a Quebec designation, which doesn't exist outside of Quebec. So within the province, where recruitment is very competitive, it may actually be a positive for us. The hospital, as you alluded to, has been an amazing magnet for talent for years. To your point, it may help us locally within Montreal, within the province. Recruiting externally really hasn't been much of a problem for us.
You know, I wonder, just as a last question, I don't want to get it, into politics here, but, there is an election coming up in October, and I think a lot of people look at anything that happens when a government is approaching an election as, in a bit of a cynical fashion. So when I asked you before, why is this taking so long to happen, do you think there's any politics involved in this?
Well, there is a process attached to this, and so this time around, with respect to this process, it's not something that came up a few weeks ago or even a few months ago. It's been ongoing much longer than that. Before anyone knew, when the process would be brought to an end, before, we knew there was going to be an election. And I think the government, to be fair, did the right thing. It just happens to have happened when it happened.
About coincidence, but perhaps best left for another day. Dr. Rosenberg, I thank you so much. And I guess on behalf of everyone, congratulations to all those who contribute at the Jewish General. You're so welcome. Thanks so much for the time. Appreciate it.
Okay, good afternoon.
Take care.
Hello, Canada.
This is Bryan Adams Radio. Hosted by Bryan Adams himself.
We'll play a few of mine, a ton of my favorites, and some must-hear behind-the-scenes stories from the world of rock and roll. One thing about doing rock and roll so long is you end up meeting a lot of the people that you admire. Sometimes you even get to work with them.
It's only love, and that's all. Bryan Adams Radio. I'm coming back to you. Now available on the free iHeartRadio app.
Everybody, how are you tonight? Sounds